Hello everyone and welcome back to the channel. This is Doc ID, infectious disease physician, and today I am going to talk about strep infections. And to start it off, we're going to talk about strep throat. So don't forget to subscribe and hit the notifications button, put it on so that my new lectures that are going to be coming out, you can get them right away. All right. Alright guys, so we will start off with the classification of streptococci. There are 30 species, 5 are significant pathogens. We go on to this next graph. You can see there's alpha, beta hemolytic, and gamma hemolytic. We're actually going to talk about beta hemolytic, which is Streptococcus pyogenes, also called group A strep, and from what you guys know as strep throat. It's a very important global human pathogen and it causes a variety of acute infections. The most common infection is actually Streptococcal Pharyngitis. Also causes other superficial skin and soft tissue infections, which include impetigo, erysipelas, cellulitis, and also causes severe life-threatening infections called scarlet fever, can cause bad pneumonia, bacteremia, necrotizing fasciitis, and streptococcal toxic shock syndrome. We will talk about these in other topics. But today we will go on to Streptococcal Pharyngitis, also known as strep throat. The most common bacterial infection of childhood. There's more than 600 million cases that occur annually worldwide. It occurs primarily among children 5 to 15 years of age, but peak incidence can occur during the first years of school. All age groups are susceptible. There is no gender predilection. Primarily occurs by direct person-to-person contact, most likely via droplets of saliva or nasal secretions. Crowding, such as occurs in schools or barracks, it actually favors the spread of the organism. Strep frequently colonizes the throats of asymptomatic persons. The pharyngeal carriage rates among normal school children can be as high as 15 to 20%. Clinical manifestations, usual incubation period is 2 to 4 days. The onset of illness usually occurs rather abrupt. You have a sore throat, you have some fever, and a headache. Then you can have nausea, vomiting, abdominal pain are also very common in children. Physical findings, as you can see in this graph, includes redness, what we call edema. You can see enlarged hyperemic tonsils and these exudates that you can see on the tonsopharyngeal area. Include temperatures of up to 101 degrees. Laboratory findings include a positive throat culture for the beta hemolytic strep. White cell count, inflammatory marker, infection marker is usually more than 12,000, and the C-reactive protein is usually positive. In the absence of separative complications, which we'll discuss later on, the disease is actually very self-limited. Fever usually resolves within 3 to 5 days, and almost all acute signs and symptoms subside within 1 week. Jumping on to separative complications, that's really inflammation in the facial area that can actually affect structures directly contiguous to the pharynx, and it can go and cause such things as peritonsillar cellulitis, peritonsillar abscess, retropharyngeal abscess, can cause a mastoiditis, sinusitis, and acute otitis media. These areas can then lead to meningitis, brain abscess, and streptococcal pneumonia is another potential complication as well. The non-suppurative complications which are common are acute rheumatic fever and acute post-streptococcal glomerulonephritis. Now we go on to the diagnosis, and really it's upon clinical, which the physician goes and sees the patient. A throat culture, which usually is a gold standard, takes up to 24 hours, or what we usually get done is the rapid antigen detection test that you get done, resulted in literally minutes. Therapy is obviously, drug of choice is penicillin, and it's usually a course of 10 days. So I hope this was informative, and our next topic will be about rheumatic fever. So I hope you guys found this talk to be informative. We're going to talk about more strep infections, where they originate from, and what do they cause. So get back to you soon.